It was very apparent early on that I was wired to fix things. See something that's broken and fix it. And I loved general surgery, I loved OBGYN, and then I did a rotation in ophthalmology. Once I did that, I put the blinders on because it was just the perfect fit for me. I love science, I love technology, and it is the perfect marriage of you see something that's broken, you fix it, and you get to use some of the most amazing tools to help patients. The cool thing about ophthalmology is it's constantly changing. I'm learning every week, every month, every year of my practice. It's constantly evolving. So undergrad was in Cincinnati at Xavier University. Came out of there, got into the Medical College of Ohio in Toledo. Through medical school, I knew I wanted to be an ophthalmologist. I did a rotation through Henry Ford Hospital's Department of Ophthalmology, and I secured a residency position there. Instead of just coming out and practicing general ophthalmology, I went on and specialized, and I did a fellowship in Kansas City in cornea. And where I did my corneal fellowship just happened to be a hotbed in the development of excimer lasers, these laser devices that do laser vision correction. And we were doing the FDA studies to get these devices approved. And there were more there in that facility than anywhere in the world at the time. So it jump-started my career. We pride ourselves here at Revision to deliver the best patient experience because simply, that's how we want to be treated. In order for me to make the patient experience what we want, I have to make my employees number one. Then they're able to pull off the tremendous patient experience that is our desire and our goal. When they touch a patient, no matter what point that touch is, whether it's the first phone call to the last walk you out the door, that's really important that our team is cohesive. Here at Revision, we have a lot of options for patients with regard to technology, but that impacts visual outcomes. Having options is a wonderful thing for patients. You know, this technology, it's not the same thing stamped out for everybody. This isn't a one-size-fits-all. This is literally a tailoring of the technology to the person in front of us. I'm obviously biased, but I think this is the most important decision. Can you think about another decision that impacts every waking minute for the rest of your life? I can't. Can you think about another investment that you would make that would impact every waking minute for the rest of your life? That's vision. The operating room that you see behind me is the most sophisticated operating room for eye surgery in Central Ohio. Those two lasers are the perfect marriage for whether we're working on the cornea to do LASIK, or whether we're working on our lens where a cataract is and using that technology to drive implants that correct nearsightedness, farsightedness, and astigmatism. And so on the front end of their exam and the back end of their surgery, we have embraced technology as much as we can. If I had to choose one word to describe my career, it would be fortunate. I am in the sweet spot of medicine. There is not a specialty in medicine that can impact patients on a daily basis in a life-changing way like ophthalmology. So the things that I enjoy the most are flying. I'm really fortunate to have learned how to fly and able to fly on a regular basis. That is something that, again, I'm switched on. It's technologically advanced, and you got to be on point. And I feel like a teenager when I'm flying. It's such a neat experience for me. And then golf is a big passion of mine. I've played my whole life and just love trying to become better and better at that. And then my children. I have a daughter in Detroit, I have a daughter in Chicago, and I have a son in Vancouver, British Columbia. And so visiting them is obviously high on my priority list, and it's a lot of fun when we get together.